The sessions are awash with CAR-Ts, and I was speaking to a colleague, Miguel Angel Perales, who recently wrote an editorial, Fast Cars, which car? And that, I think, is the concurrent debate. There are clearly a number of CAR-Ts that are now coming to the fore. Studies have been done in significant numbers in the US, perhaps less so in non-US centres, European centres. And there are autologous CARs, and the problem is that the technology is moving quickly as well. So which type of CAR is it? There are different types of CARs in the US, and the autologous programs seem to be the major players at the moment. But there is another allogeneic CAR from a French company that is likely to start clinical trials, and indeed our colleagues at Great Ormond Street treated the first child in the world with this CAR, and indeed we at King's treated the first adult with the allogeneic CAR. So we hope to start gaining some real experience. Where should it be placed? Well, there are people talking about it as a useful treatment to obviate the need for transplantation in some children. And there are centres in the US that are advocating that and doing trials on that. There are some people that say it should be retained for patients who relapse and then use the CAR-T as a bridge to transplant. And then there are others who say, look, one of the biggest issues that we face in transplantation is relapse. How could we use CAR-Ts, and remember, we're talking about malignancy-related CAR-Ts, but there are a whole area of CAR-Ts against fungal epitopes. Colleagues at MD Anderson have been working on a Dectin-1 CAR-T in fungal disease. So as much as we might have started off with fungus, we have also moved to a point where this technology is not just going to be available for patients with malignant disorders. There are other areas where we may use it. I think the biggest problem is actually delivering the CAR-T, as well as producing the CAR-T, and of course the overriding factor that we do have to mention is how much will it cost. I don't know how much it will cost, but I'm going to assume that it's not going to be the size of a small Skoda Fabia. It's probably going to be the size of a very nice Ferrari. So which car, as Angel said, is for sure, I think, the more expensive car, and we will then need to judge whether the early phase data can really pan out into large practice phase 3 and then obviously phase 4 scenarios.